Welcome everybody. I'm Nicolette Boter. I put myself forward to be the independent chair of the Bath Area Forum for this year. And I'm delighted to welcome you to this event, which is an opportunity for us to receive an update on COVID, including the vaccine, the booster and flu, as well as understand more generally about the winter pressures, particularly in health and social care and other public service. It's also an opportunity to hear any concerns you have and facing our communities, as well as thinking about how we can work together to play our part in building our local resilience and strength. And at the end of the presentation, there'll be an opportunity for you to ask some questions, and we'd really welcome hearing more from you about the issues, your ideas, the concerns you have on this. Our speakers this evening include Will Godfrey, the Council's Chief Executive, Becky Reynolds, Director of Public Health, Jill May, Director of Nursing and Quality at the CCG, and there I can see a number of Cabinet members here too. So without more ado, let me hand over to Godfrey to introduce the discussion.
Okay, thank you very much, Nicolette. That's really helpful, and good evening, everybody. Can we put the presentation up? Is that you doing that, Mark? Okay, let's move to the next one, please. Okay, so as it's been sort of trailed, so this is what we want to just give you a bit of an update on tonight. So in a minute, I'm going to hand over to Becky to talk a little bit about the sort of current scenario around COVID, and obviously in the last few days, I suspect people's level of concern may have raised, obviously, in terms of the new variant. So Becky will talk a little bit about that, and then Jill will talk about the vaccine programme. We do want to talk a little bit tonight around, the ongoing pressures across both the council and also the health service around the pressures that is putting on public services. And again, just to be really clear and open and honest with people about what difficulties that's bringing us. We hope and we believe that most of that is relatively short term, but again, it's important that we're really clear with communities around what's happening there. And that's, of course, in the context of not only COVID, but we're now into probably more sort of adverse weather, and obviously the issues that brings around winter flu, etc. So we'll just touch on that, and as I say, we'll touch on the pressures. I'm not going to talk too much tonight about the budget. There's a separate budget session for the council on the 14th of December, but I will just touch a little bit on the impact that the council's had to manage over the last 18 months or so, which will hopefully just give you a little bit more context when that discussion starts around the budget. And as I say, that there's a separate briefing on the 14th, and then really just talking about how we can all work together and sort of help each other again over the next few months, which I think will be difficult on some levels. And again, just be clear about how we can do that. So if we can go to the next slide, then I'm going to hand over to Becky. Becky.
That's great. Lovely. Thank you, Will. And it's great to be here. And thank you. It's good to see so many people on the call as well. So I've got 2 slides to go through, but just before I actually start talking about this one, I want just very briefly to give an update on Omicron, so the latest COVID variant, which we'll have all read about and heard about on the news many times, I'm sure, over the last few days. And it is such a big reminder, isn't it, that COVID is still with us, the pandemic is still with us. So the Omicron variant has got lots of mutations that could suggest that it might be more transmissible. It could potentially cause more severe disease, and potentially it could make the vaccines less effective. But we don't know enough about it yet to know whether that's the case, and if it is, to what degree. So a lot of data is being gathered at the moment to help scientists understand that a lot more. And it will take a couple of weeks really before we are much clearer as a population on how big a threat the variant poses. So it's a very rapidly evolving situation. And even though we might hear the impact that it's having on other countries such as South Africa, we are a very different population. We're an older population. We have a different vaccination schedule than other countries, than South Africa does. So it's not always straightforward to translate what's happening in another country and assume it will happen here. So we will certainly find out much more over the next couple of weeks. In terms of numbers, the numbers of confirmed cases of the Omicron variant in England is now 22 when I looked a couple of hours ago. We don't have any confirmed cases yet in the Southwest, but fully expect that we will have. And it's also useful for people to know that if you are notified by NHS Test and Trace that you are a close contact of someone who has this Omicron variant or someone who is suspected to have it, you will be legally required to self-isolate, whatever your age and whatever your vaccination status. So that's a little bit different with this particular variant compared with the previous, the Delta variant. So I'll just say that again. So individuals, if you end up being notified by Test and Trace that you're a close contact of a confirmed or suspected person who has the Omicron variant, you will be legally required to self-isolate, whatever your age, and even if you've been double vaccinated. And then if we do identify cases of Omicron, the Omicron variant in Baines, our approach, along with all other parts of the country, will be to limit the spread of the variant by putting in place very rapidly some highly targeted testing within specific settings, depending on where the person who has had COVID has been moving while they've been infectious. So it might be in the workplace, or in the school, or on the street level in business. And so we would look, working very closely with the UK Health Security Agency who lead on this, we'd look very quickly to either bring a mobile testing unit into that area or to do some targeted home testing. So there are some well-planned delivery models in place. Okay, so now I'll just sort of take a step back and move on to COVID updates more generally and talk through this slide. So as we can see from this slide, our current rate is 383 cases per 100,000, our current 7-day rate, and that's a drop from the previous 7 days. So we're seeing a steady decrease in trend, which is really positive because we had rates that were right above 1,000, if we remember, not too long ago, only 2 or 3 weeks ago. So that's really positive. The England rate is 440, so our rate is lower than England's, and the England rate has been increasing for the previous 7 days. And the Southwest rate is even higher, so that's 519, and that's staying fairly level at the moment. In the hospital, in the RUH, we've currently got 33 patients in hospital with COVID, and that's a mixture of Baines residents and residents from surrounding local authority areas. It's been consistently sort of between 30 and sort of 25 and 35 for the last few weeks, so it's fairly consistent at the moment. In terms of testing, so that the second half, the right-hand side of the slide, talks about our rapid testing process, and we have an outreach van. So it's a reminder to me to talk about the importance of all of us testing ourselves regularly for COVID using the rapid tests, the asymptomatic tests. So they're tests to be used when we don't have symptoms. And the new recommendation that you may or may not have picked up, it just came out on the news yesterday, is to take lateral flow testing before times of high risk. And if you're going to see someone who's elderly or who's vulnerable, who could potentially be more seriously ill if they get COVID. So in terms of times of high risk, that means that if we're going to a highly crowded place, for example, or we're thinking about Christmas gatherings and Christmas parties, or if you usually work from home and you're going into work. So before you're going into crowded places, the advice is to take a lateral flow test. And then if you're going to visit someone who is older or who could have a more serious illness, also to test yourself, as it's a way of identifying someone who may have COVID but not have any symptoms. And also a reminder that even if we've been vaccinated, we could still contract COVID and still pass it on. So it's still hugely important to still test ourselves, even if we've been vaccinated. Those rapid tests, LFDs, can be picked up from a number of places. They can be collected from the hub in the Bath City Centre. A number of libraries also stock them. So the Timsbury Library, Radstock, Bishop Sutton, Weston, Midsummer Norton, Keynsham, and also the Bath one-stop shop. Most pharmacies stock them, or we can order home test kits either online or by phoning 111. And that picture of that van there, that green van, is the image of our outreach van, because we do have a COVID-19 asymptomatic testing outreach van that's part of our targeted approach to really promote this community asymptomatic testing, to try to reach groups who wouldn't necessarily go into a pharmacy or who wouldn't necessarily go into one of the libraries or order a test kit online. So particularly for people who might be experiencing homelessness or rough sleeping, or people who are in contact with substance misuse services. So if you are, and that's what we've got on the right hand side, there is a schedule of where that van is going to be. And if you've got thoughts of other areas within the Bath Area Forum, where you can think that it would be really a useful venue for that outreach van to be at for a day, please do let Dave know, if that's okay, Dave, and I'm sure he will pass that on to the public health team, and then we can arrange that with you. Okay, thank you. If we go on to the next slide, please. So in terms of what you can do, what we can all do to help ourselves locally, especially as we come into winter, although our COVID rates have dropped hugely, and that's really good to know, they are still high at over 300, and we don't know what's going to happen with the new variant. So in order to keep the sort of freedoms that we all want in our everyday lives, we want to enjoy them, we need to keep COVID rates low enough. And so we need to continue with all of these measures. And just a great thank you to people who are already doing and taking lots of these measures. And I'm very sure that that will be a large part of the reason as to why our COVID rates have dropped so much, is because from the high rates, I'm very sure that shook all of us or a lot of people up. So they will then have started to put in place and take on board these protection measures. So do get the COVID and the flu vaccination that you're eligible for, and Jill will talk about that in a little while. There is increasing evidence coming together that suggests how effective face coverings are, both in reducing the number of respiratory particles that breathe out and also reducing the number of particles that people can breathe in. And obviously we've got new recommendations now about wearing face coverings in shops and on public transport being mandated for the next 3 weeks at least. We've covered lateral flow tests. If anyone has symptoms, then the test to take is a PCR test. And if anyone is feeling poorly and feeling ill, then the advice at the moment really is to stay at home, because there are other winter viruses going around at the moment. And finally, we're really trying to boost up our support that we're providing to businesses. So we're going to be setting up an online business hub where businesses can get further information and support and advice, to work with businesses to encourage them to put up posters encouraging customers to use face coverings, to make hand sanitizer available, and to try to keep space available so people can keep socially distanced in those venues. Thank you very much, and I'll keep an eye on the chat and answer any questions that come in there that are relevant to those 2 slides. Thanks, Will. I'll hand back to you.
Thanks, Becky. And I'm now going to hand over to Jill, who's going to talk about the vaccination programme and a bit more about some of the pressures on the health service. Well, Jill.
Thank you very much. If we could go to the next slide, please. Thank you. So we know that the booster programme gives 90% protection against symptomatic COVID-19 in adults, particularly over the age of 50. So really, you know, we are now maxed out, inviting everybody over the age of 50 to come and get their booster vaccine. You will have heard over the weekend, and particularly on Monday, that those aged 18 to 39 will also be invited. Now, one of the big changes there is that up until this point, people have been invited back to have their booster at 6 months following their second dose. That has now been brought forward to 3 months. But today I can confirm that our national booking service will start to invite anybody aged 18 to 39 after Christmas, and it will be in 5-year age groups. So it will be a staggered approach, and that is to make sure that we still concentrate on those aged over 50 and particularly over 70 to still get their booster, and also to make sure that anybody yet still to come forward to have their first vaccine. We know there are at least, well, we're seeing about 50, 60 people come every day to pick that first vaccine up, but across Spain, Swindon and Wiltshire, last week there were still 100,000 people still to come. At the same time, those aged 16 to 17-year-olds are now being invited to have a second dose. So more than 271 boosters have been given across the patch. And at the same time, you are aware that our Virgin Children's Services are in schools offering those aged 12 to 15 a vaccine dose. Now, again, there were changes this week. So any of you who are parents to children in that age group, if a child was COVID positive, they now have to wait 12 weeks until they can have that dose. What we are doing is we are offering a supplementary offer that parents or carers could take children to one of our sites where they are also able to vaccinate children of that age group. However, Virgin are still going back into those schools to make sure that educational offer is put in place so that we don't find ourselves that some children don't get that opportunity to take up the offer. I do want to say to you that, you know, as Boris Johnson said, that first week in January, our capacity needs to be stretched because he has offered that every adult will be offered that booster by the end of January. So just to give some context, we now routinely give 35 to 38,000 vaccines each week across the patch. We are going to need to double that. So we are doing an awful lot of work now to make sure we increase the capacity and sites to offer it. Next slide, please. So this next slide, it's a busy slide, but it just look at that top left hand. 1,740,000 people have had a vaccination. And this week, because it is the Baines patch, the racecourse are going to celebrate that they will have vaccinated 200,000 people. Some of these bubbles use the word cohort. We use that word purely to express that age group. I also want to make people aware, because I've had quite a few contacts from councillors, parish councils and MPs. A number of people are still a little bit confused if you're in that cohort of what we call immunosuppressed. So for example, somebody undergoing cancer treatment, or they're having treatment because of their arthritis or something. They are in that age group and they were offered what we call a third primary care dose. We are now calling that just a booster. But to note, if you are immunosuppressed, early in the spring, we will be offering people a fourth booster dose if you are in that age group. So just to say, it is absolutely full on, and I really want to ensure we are trying to make sure that there is access across geographically. And one great thing to share with you today, our vaccinators were out vaccinating our boater community in Bradford-on-Avon today, and they vaccinated 54 people. So that is absolutely great, and we're still making sure we're concentrating on those that are housebound and in our care homes. I don't know if Corinne is on or whether Bryn Bird is on. Have they joined us?
No, I don't think they have, Jill. I'm just checking that.
So if you're okay, I'll quickly take us through these next two slides. I won't do it as well as Corinne or Bryn, but I'm happy just to share about the health pressures if we go to the next slide. So alongside our social care colleagues, there's incredible pressure in the system, and particularly at the Royal United Hospital, they are incredibly busy. And again, you'll have seen in the press, we're seeing a lot of ambulances that are having to queue in order to get people into that ED department. One of the things that is that we're seeing is an increase not only in adults but but within our children, respiratory infections. And Becky mentioned just now, we are also starting to see outbreaks of diarrhea and vomiting on our wards, which means we have to close wards. So I emphasize, if you have any of those symptoms, please stay at home and seek contact from the phone. Do not go somewhere. It spreads very, very quickly. We're also ensuring delays in seeking medical attention. You know, our 111 lines are very busy. We're hearing from a lot of people that are trying to get dental access, etc. What we are noticing, people are just struggling on, and that means that we are seeing people perhaps more seriously ill, and we would have liked to have heard from them a little bit sooner. We're still trying to support our primary care services to catch up on more routine screening, which has been delayed. And just to give an example, that would be cervical screening as an example, and also other vaccinations that are really important. And I have mentioned the vaccine programme. So we know, and I know Will come on to it and others, we are seeing increased demand. The acuity, and by what I mean from that is, we are seeing people a lot sicker, and therefore the demand on services when we discharge them are greater. So on domiciliary services, on reablement is far more under pressure than we have ever seen before. And of course, our workforce are tired. And we would never have dreamt that we would be in this position. So we are doing a lot of work to make sure we increase our staff recruitment, get additional workforce in, but we also want to make sure the health and well-being of our staff means that they will stay with us, so we retain them in our services. So we're doing a lot of work to do that, which also includes making sure that we can get a workforce to give these vaccines without relying on our primary care services to do it. So that's where we are. I'll hand back to Will, and then again, happy to take questions at the end. Oh, sorry, this was one of the slides that they were talking to. So what can you do to help? So we really want to make sure, as I said, please ring 111 first. Practice self-care, stock up on your medicine cabinet, make sure you've got paracetamol in, make sure you've got a Calpol in for your children, but also drink plenty, just generally look after yourself. If you've got coughs and colds, they will soon go with some home management. There is opportunity to get free help and support from the Live Well Hub, and the contacts for that are put in the chat. So please use that, and look out for neighbours and volunteers at your local vaccination centre. And here we go again, volunteer banes. The one thing we are saying is, we live in a world now where in some streets people don't know their neighbours. We are just asking people to look out for those signs that maybe people haven't been able to get out their home and they may need help with shopping or getting their medicines. So all I would say is, please look at these links. We in the CCG, again, working with our local authority, are doing some work around shaping a healthier future, around a new health and care model in the future, and we'd love to seek your views. So please tap into those links, and we'd love to hear from you. Thank you very much. Back to you, Will.
Thanks, Jill. So can we go to the next slide, please? Up. Okay, so I just want to give a bit of context for the council budget, and as I say, there'll be some more detail about this in the next couple of weeks. But just quickly rolling back to sort of March, April 2020, and that financial year, just to give you a bit of context to understand where we were. So the council, you know, historically, and again, different councils, I've worked in eight, 9 different local authorities, and every authority has got a different foundation to its finances, just because of their makeup and the sort of history, as it were. So Bath North East Somerset has historically been very dependent upon income that's generated from 3 sources. So car park income, commercial estate income, and also income from our heritage estate. So principally things like the Roman baths, etc. And of a budget of about 120 million-ish in a in a sort of a what might have been previously described as a normal year, those three income streams generated about £45 million. So you can have a debate about whether or not you think that's right or wrong. The reality is that was the financial foundation of the council, plus the fact that because we raise a lot of our income, we actually get less government support than many other local authorities. So we're the fifth lowest core spending power authority, and that's basically an expression of how much spend there is, and that's, as I say, a sort of a historical quirk. And then you also talk about the fact that our makeup demographically is we are skewed towards an older population, which obviously brings significant demand around social care, and adult social care in particular is just about half of our annual budget. So in March 2020 and April 2020, once the first lockdown came around, what was really clear was very early on, a huge amount of that income stream just disappeared. So obviously people couldn't come in and use car parks, people couldn't come in and use their own baths, businesses who were occupying our premises were obviously under huge financial strain. So in that period from probably April 2020 till August, September 2020, we were projecting that we would lose about £30 million of that £45 million that sustains a lot of our services. So we had conversations very early on with central government about just to get them to understand that was the challenge that we had, and those conversations were part of the build up to the government rescue package that they put in place for local government, which was announced early July in 2020. And we also worked very hard to put in place a financial recovery plan. So in June 2020, we also identified about £20 million worth of in-year savings to try to make sure that actually we maintained our financial position, whilst obviously trying to do as much as we could about sustaining frontline services. We were able, because we got hold of that position really quickly, we were then able to balance our budget in 2021, so that's the period to March 21, and we were also able to put money into our reserves. So we're now in the financial year 21-22, and even in this year, some of that income that was reduced is still, it's still not back to where it was prior to the pandemic. So whereas in 2021 we think we'd lost about £30 million, in 21-22 we think we've lost about £15 million. So you'll see that actually that still creates a really significant ongoing pressure for the council when we're trying to deliver frontline services. So when we do the briefing on the 14th of December, what we will do is explain how for 2022-23 we are essentially rebuilding the financial foundations of the council. We're rebasing those budgets to try to take account of what we think are some elements of the impact of the pandemic that we think are fairly short term, and some elements that maybe are sort of longer term scenarios. So a good example of that would be that if you look at the income we get from our commercial estate, we think that's a more long term issue, because actually, perhaps people do more online shopping now, so maybe the number of shops isn't as much, and people aren't prepared to pay as much rent as they were previously. So that's a more structural thing. Whereas elements of the cost that we've got that are perhaps related to the fact that we've had workforce pressures and we've had to bring people in to cover work, we think some of that is a more short-term cost pressure that will hopefully go away as hopefully the impact of the pandemic goes away over the next few months. So, we've got to identify those short-term and long-term issues. Then we've got to find solutions to that and understand what that does to the budgets and try to explain that to everybody about what's going on. But we haven't just been sitting here thinking this is all about managing the pandemic. This is about saying that actually we've still been looking at modernising and future-proofing frontline services. Again, that's not about just saying everything goes online. That's about trying to understand how we can improve services, how we can do some work internally to make sure that actually there's more efficiency internally. And again, you'll see more of that on the 14th of December when we talk more about the budget. And we are looking at areas where we can generate more income, etc., and trying to make sure that we absolutely do prioritise frontline services. Go to the next slide, please. So even accounting for that, people will undoubtedly have seen over the last few weeks that we have had pressures on our organisation, and I'm not going to sit here and say that everything is running exactly as it was pre-March 2020. It absolutely isn't. But what I would say is that that's a situation that's faced in many parts of the economy. I was saying to people, I was in Sainsbury's yesterday, walked around Sainsbury's, and a lot of their shelves are empty. You wouldn't have found that prior to March 2020. So every part of the economy and every organisation is finding challenges that are associated with COVID, and we're no different. We've had some really big issues around staffing. So people being off sick with COVID, or people having to if their kids have got it, for instance. We had a big spike of cases in schools that then obviously puts pressures around childcare, that puts pressure on services. All of those sort of things build and build. At the end of September, our contract ran out for our street lighting services for electricity, and we were faced with a £500,000 additional bill just for electricity for street lighting. Now, we can't just go, oh, well, forget about that, we won't switch the street lights on. We've got to deal with that. We have to manage the impact of something like that within our financial position. Again, that's just an example of something that wasn't completely easy to foresee, and those sort of things come along, and you have to manage the pressure around that. People will have seen a lot of media coverage about the shortage of HGV drivers. Again, that's been across the different sectors of the economy. That has had an impact for us around particularly how we've managed to get resilience around our refuse and recycling services. And even when we've had drivers off sick and things, we've gone to agencies, and they've not been able to provide the drivers in the way they were previously. We've looked at how we can train people internally to be drivers, but again, the difficulty is that pre-March 2020, it probably took 3-6 months to train somebody to become a driver. Now it takes between 9 and 12 months because there's a huge backlog in actually the training process and getting people tested and all of those sort of things. So all of those issues have an impact on our ability to sustain exactly the level of services that we'd want to. We are doing our best to prioritise frontline services. We are trying to make sure that when we have those challenges, we keep people updated through the website, through social media, through events like this, all of that sort of stuff. And we also know that, as I said before, the winter perhaps gets the weather gets a bit more challenging as we go into the winter months. We're clear that we've got the priority issues like gritting routes, etc. We're well prepared for things like that, but there may well be some challenges again that will stretch elements of our resilience in the short term. So my overall message about this is, we want to sort of make sure that people are aware the pressures are there. We hope you understand that we're doing the best that we can. We will keep communicating, but we are asking for a bit of patience and a bit of understanding, as actually people are very stretched, and people are very, very tired in terms of the work that they've been doing over the last 18 months. So we will keep working on that. Next slide. So I think are you gonna do this, Tim?
I can as well, BB. I wasn't expecting as usual, but I will do it for you. Okay, Sorry, Will, apologise, cutting in. Okay, we're in a situation at the moment. We're asking people to possibly keep recycling as much as you possibly can over the winter period. It certainly helps our waste teams, help us sorting the recycling out, and to minimise packaging as much as possible. Unfortunately, this year, same as last year, we cannot collect Christmas wrapping paper. No matter how good the actual people say it is, it's still contaminated with plastics, your ribbons for Christmas, and it simply cannot be recycled. Please try and use gift bags whenever possible. Brown paper is even better, it can be fully recycled. Cardboard boxes or fabrics, much easier. Also, get tips on energy efficiency in warm homes with Energy at Home website. And please share this with as many people as you possibly can. Next slide, please. Well, looking after community this winter, very important we all look after each other to make sure we're all healthy. The Community Wellbeing Hub can help with many issues around that regarding housing. You're feeling isolated and anxious, access to food, transportation, medication, keeping healthy, money advice services, achieving healthy weight. Please share this information as much as possible with your neighbours and friends, and much of you possibly can in your community. Next slide, please. Well, what we do locally to help? Well, there's plenty of actual feeds around on the social websites, Twitter, Facebook, Instagram, YouTube. Please look at them all and help your neighbours to stay healthy this winter. Thank you. That's it from me.
Okay, so I think that's the end of our presentation, Nicoletta. We're obviously happy to take questions. I know there are a few questions that have been raised in the chat, and I'm sure we'll try to deal with those as we go through.
Well, thank you very much, Will and Becky and Jill and Tim. It is really useful having that sort of overview where you can see behind the figures and the facts which we get and understand the huge amount of balancing of pressures and response. I know there have been some questions being asked and answered in the chat, but if anybody's got some more questions or ones they want to have asked, do either use the reaction button and put up a virtual hand, or just physically show me your hand. Great, I now can see everybody on the screen. I know there was quite a lot to absorb, so don't be scared to think for a moment and compose a question.
Can I just deal with a question that was raised by Tommy about the
Go ahead.
budget? So yeah, so basically what we're saying is that that's £30 million worth of income that ordinarily would have come into the organisation. Part of that was replaced by government grant that came in, and part of that was dealt with by actually reducing elements of expenditure that we thought we would have incurred at the beginning. So it's a balancing factor, and that's why essentially we were able to balance the budget by the end of the financial year. Hopefully that gives a bit more context to that.
Oh, Jill, you've got a hand.
Yes, so I wonder if I could respond to the chat around, one around the racecourse and accessibility and around walk-ins. I totally understand people will look outside our area and see what is in place around walk-ins. I did put it in the chat. We constantly, every day, look to see where we can offer walk-ins or grab a jab. I am being very honest and transparent with you. You know, the race course, we have got community pharmacists across the patch that are putting their availability in. It is being taken up very, very quickly, and therefore our ability then to offer walking on top of that is a bit limited because of the workforce constraint. So as I said, we are looking here and now as to what we can do. If I could just say about the racecourse, when this vaccine programme was first commissioned, NHS England had secured the racecourse on our behalf. Becky is aware of this. We really are now needing to look at where we could have a large vaccine site closer to the centre going forward. Anybody that was up at the racecourse this weekend with the snow and the wind, it's in a marquee, and also the public transport. We did get free transport for a period of time. It is difficult. This programme is going to go on next year as well, because we do highly suspect this will be a biannual vaccine programme. So please be patient with us. I know we can look outside and see what others have got, but we really, our modelling says we are putting as much capacity out as we can and getting the vaccine in. We will endeavour to do more and more. So just bear with us, but we are trying to address those very problems that you're putting in the chat.
Thank you, Jill. Can I ask a question? What advice and actions do the council and its partners have planned in reaction to the new Omicron COVID variant?
So the public health type actions, so the actions that individuals can do in order to protect themselves, are exactly the same as they are for the ordinary, the previous variant, so the Delta variant. So that's about testing ourselves regularly if we don't have symptoms, immediately self-isolating and taking a PCR test if we do have symptoms, washing our hands regularly, the hand hygiene. If we're going indoors, outdoors is safer. If we go indoors, ventilate, and so every hour or so open the windows for 5 or so minutes. So those things are the main things in terms of prevention. If we do have a case of COVID, then we will be contacted immediately by the Health Security Agency, the UK Health Security Agency, their health protection team, and they will set up what they call an incident management team. They'll basically bring people together around the table. They do all that contact tracing to find out through NHS Test and Trace to find out who the contacts are of that case, and that would inform where we would then deploy or send additional targeted testing, whether that's through an outreach van, whether that's trying to cover a few streets in terms of putting tests through letterboxes. And the purpose of that is to very quickly identify all the people that person who had the Omicron virus have been in contact with while they were infectious, and those contacts would then be asked to self-isolate. So it's very quickly trying to identify those people who are contacts and ask them to self-isolate. So those are the main things we would do in terms of prevention. And if we actually had a case, was there something else more specific?
No, that was a sort of fairly general one.
Thank you.
Another question. I can't see any other questions coming, so I'll take the opportunity to ask another one. From the point of view of somebody who knows they are now within one of the cohorts which are eligible for a booster jab, and if you're time poor and you're wanting to get it as soon as you can, it's really difficult to know what is the best way to go. So you could go for your closest one and then find you've got a month's wait, or you could say, should I go up to a walk-in and try and get it sooner? Or is there seem to be too many pathways, and you spend ages trying to work out which one to go for? Is there any?
So I really recommend the National Booking Service is the one to use. Just keep trying. Availability comes on. We put it on nearly every day. So again, I put it in the chat. What we are seeing is that some people have already got a booking, and yet they're still trying to get it sooner, but then they're not cancelling their booking. So that's when we see a number of did not attend. I reiterate, and I'm going to be really quite blunt here, in order to say to everybody, we need everybody to be patient with this. we, you know, that 6-month period still gives us that protection, even though they've brought it forward to 3 months. That is in order, in response to this variant come out, let's just rapidly get as many people through. So I urge you to keep trying if your first venue doesn't come up straight away. As I said, daily additional appointments get put in place. And as I said, if you book one, and then you find another alternative, please cancel that appointment so somebody else could take it.
Thank you. I can't see any more questions, so here's another general one. Pressures on the RUH and what can residents do to try those pressures?
Nicola, could you repeat that again? Sorry.
Okay. What can residents do to support the pressures which on the RUH, which?
Okay, so I'm happy to come in here. So I think I mentioned some of it is that, you know, use those on the day urgent services appropriately, you know, use the 111 first, rather than going to an ED department when you needn't. Secondly, and I note some colleagues on this call, it's a really difficult one, but the one thing that we are looking at is for those people that remain in hospital beyond the point in which they need to, it is around that family carer community support. Absolutely, there are people that need reablement and services because they need that. There are others that maybe could go home, but with just some other neighbours popping in on them. If people can help, if they can help people with transport getting them home, please try to do that. I think it's just recognising to use those services appropriately at the point you're trying to seek some advice around, you know, getting medical attention.
Okay, thank you. And I can't see any more questions, but if you have got a question or comment and I've missed you, do just switch off mute and say it. Otherwise, I think we're sort of getting where I think we can. Thank you very much, everybody, for the presentation and for the answers and all the information that was in it. I think we've got a couple of notices before we close the meeting. So firstly, a reminder of the Care Commissioning Group survey, Shaping a Healthier Future, and for any residents and people here, it's seeking views about a new health and care model and conducting a survey, and we're holding online workshops on the 8th and the 9th of December. You've already been told about the forthcoming budget discussion and giving a bit of appetizer for that, and that's on the 14th of December at 6 p.m. and that's online as well. And we will be circulating the details of that meeting if you haven't picked them up in the chat. And then I think future meetings into the 2022, the next forum meeting is on the 2nd of February. And I think that's all I can say. Thank you for bearing with me. It's my first time of chairing. And it's very different to being on the other side, just thinking of the questions you want to ask. But hopefully I will improve over the year.